Dr. Juan Quiroz.
Hello there. Good morning.
Good morning. So today's event reflects a shared commitment to advancing healthcare for our island and strengthening partnerships that will support our hospital and the people of Guam for generations to come. We also do have some medium kits available. If you have not gotten one, we do have some available in the front. So a quick overview. In July, GMHA as well as the governor's office announced that we had a partnership with Keck Medicine of USC. We entered in an agreement designed to strengthen Guam's healthcare capacity through clinical collaboration as well as workforce development and academic partnerships. So today we'd like to elaborate a little bit further. Before we go ahead and move on, at this time I'd like to ask and invite Governor Luis Guerrero to deliver some remarks if you would like to share.
Yes, thank you very much for that great introduction and some brief comments about what this conference is all about. I also want to thank the leadership of GMH for really being very steadfast in trying to improve the care and delivery of healthcare services for people. In my whole experience with healthcare delivery, especially with GMH, there's really never been a concern about the competency, the capacity, and the adequacy and the qualifications of the staff in the clinical areas in delivering quality healthcare. People have had good experiences. Now we just need to make sure we build a new hospital so that these people, our employees, can work in a very conducive hospital facility environment. And so, as our administration had entered this last 6 years now, 7 years, one of our biggest focus and priority is healthcare delivery to our people. When our people are sick, they are stressed, and they want service that they can have of good quality and the best standards of practice. I commit that GMH does deliver. And like I said, I think we just need to improve. But in looking at all this, we of course have to make sure that all puzzles are in play to deliver this quality of health. So I have been in communication, just a little history, with Dr. Quiroz about 2-3 years ago. And as you know, Dr. Quiroz is the rotating cardiologist that comes here every 3 months, delivers great care to our people in cardiology, and is very connected with USC. And in my discussions with him, I said to him, I would like to partner up GMH with a very reputable institution. And we started talking about USC. And so I made the travel to USC and spoke to the heads of the international division, spoke to the heads of Keck Hospital, spoke to the heads of the overall USC and the leaders that can influence the decision. USC is one of the most reputable hospitals and care in the whole United States. Their reputation is phenomenal. They are advanced in procedures, operations, robotics. They're right in there in the top ranking of quality healthcare, advanced technology, and most of all, a great attention to customer service and patient delivery services. We all need that. And so when we were looking at USC, we thought, wow, it would be just an amazing, very significant impact if we could partner with USC. So we have. And in April of this year, we signed GMH, Leland Posadas, signed a memorandum of agreement with the head of Keck Hospital there. And the memorandum of agreement, and I'm pretty sure Dr. Jolene's going to go more into details about it, but the memorandum of agreement allows us operations and clinical, so that we can get trained, we can work with them, they can support us in all areas that we need support in to deliver the quality of care. They're very forward-thinking in telemedicine and specialty care. They are willing to bring over specialty clinicians. They are willing to also receive our clinicians over there for training and updating of their clinical service, both in medical and nursing. So it's a very significant milestone that GMH is partnering with this great reputable hospital institution in the United States. And so I want to just thank again the leaders of GMH for really aggressively pursuing this arrangement.
Thank you, Governor, and thank you to the team at GMH and to the team that's, I guess, telecommuting into this press conference. Over the last few years, there's been a significant overhaul and improvement across the board in healthcare services. At behavioral health, as you know, behavioral health came from a federal receivership now to an accredited high-performing organization at Public Health. There's significant work going on right now, also on the path to accreditation, but an update in medical technology and systems. And here at GMH, of course, all of us have been keeping an eye close to the issues with facilities, with administration, with getting the hospital bills paid, getting timely bills sent over to insurance providers, and making sure that we're doing everything we can to make the patient experience, to focus on the patient experience here at the hospital. I just wanted to say that the patients are, of course, the most important part of this equation. When people are going through a very life-threatening, stressful time, families are faced with trying to navigate what can be a very complex system. And of course, as the governor pointed out, there's never been a question about the quality health care that's being provided in the facility. That issue has been in facility and in operational support. And so this morning, we'll get to hear and understand what the opportunities are going to be with regards to staff development, increasing the capacity of our medical staff, providing them tools, both in technology and other clinicians, to provide patient care as much as possible on island, but to try and decrease the burden that our patients and their families have when needing to get off island care. And with that, I wanted to recognize that we have 3 patients that are with us that have been able to navigate their patient care, I think through both systems. We have Mr. Matt Kanata, who's sitting at the table, who's a longtime resident and community leader down from the south. We have BJ Palomo, a retired police officer, somebody I've known for quite a long time. And Glenn Leon Guerrero, who, as you know, has been one of the professionals in our government, both in the private and public sector, that has been helping expand and build our island. And so with that, I think we'll give an opportunity, Dr. Jolie, for the patients to maybe talk about their experience, and then Dr. Jolie will move after that. And since he's at the table, and I'm gonna first ask Matt Kanata.
What was my experience, I do remember that cart going into my room and seeing a doctor just telling me what the status, being explained what my situation is, my status is. And so they were just surprised that I survived the time when I had the COVID, that I had improved so much. And so I think that cart went along maybe 3-4 times to my room.
The telemedicine card.
Yes.
Yeah.
And then I also had to have surgery for my trach, the trach tube damaged my trachea, so I was recommended to go to Keck Hospital, and that's where I got my surgery to get it out and to have my trachea repaired. So to be able to talk.
Matt, how long, you were in the
I
hospital,
was
the
in the
longest
hospital
patient?
like 221 days in
Yes,
the hospital.
I remember that.
And I thank GMH for the services they provided to me, because I knocked on wood, I was on the 2nd wave, but the service, I mean, the care they provided for me was awesome. And you know, people like to say negative things about GMH, but no, we had great doctors and nurses, and I got to know them a lot. I made friends because of 21 days here. But anyhow, they don't, sometimes they, you know, they're not supposed to say stuff, right? But my last day moving out of ICU, one of the people I made friends with, the CNA, said, Matt, you didn't think you were gonna make it.
Oh,
Because our family was called 4 times
yeah.
to say I wasn't gonna make it, but it's a miracle of God. Thank you.
BJ?
Well, all I can say is that the communications in the referral office and the hospital there, whenever at the airport, you know, I got transported to Keck Hospital, and then I had to pre-op for Dr. Ha, which was like 30 minutes away, and they provided transportation also. And the following 3 days after we arrived, I went into procedure, which is lasted only like three and a half hours. And I was out and then out and about. And this is one that put me overnight, you know, and I was ready. I even asked the doctor, I'm good to go. Can I play golf tomorrow? He says, no, you got, you know, at least 13 days to recover, no heavy lifting and stuff again. But hey, I'm very satisfied. You know, it was so convenient. We resided over at the Hyatt House,
Yeah.
which was like three minutes walking distance from the Hyatt House to the hospital. Right. You know, so I'm just very satisfied. And then, you know, I was referred there by the Albany. Whatever thing. But anyways, yeah, you know, for the watchman, because
Yes.
the only place that they do the procedure is over at Keck Hospital. Philippines don't acknowledge that yet, you know. So I went ahead because, you know, life is short and I like to enjoy the rest of my life playing golf.
I met your wife there.
Right there?
Yeah. I met your wife there.
Yeah.
Nice, thank you.
Glenn?
Thank you. My experience was, I first came to see Dr. Jareen beginning of the year, having trouble with my lungs. And by the way, my family referred to Dr. Jareen, not just for me, but for everything that she's done and with some of the people that I know and grew up with. We refer to her as a miracle worker because she saved a very good friend of mine's life. And over the summer, as she was making an assessment, as a pulmonologist, she was wanting to do a full workup on my lungs. So I went to Keck. I got admitted on Monday, and then Wednesday they found out that I had I can only give you the layman's term, which is the widowmaker. I had a problem with that.
Oh, wow.
And so they immediately, the good thing about Keck is that they have good relationships with insurance providers here, so they were able to do things very, very quickly. And so I was there Monday, assessed Wednesday, and then they initially set me for surgery on the following Monday, and then they said, no, we'll do it on Friday. So within a week, I had my open heart surgery. So they took a vein out and 2 bypasses, and I'm here today, 7 weeks later. I'm very grateful. And you know, the care that we got at Keck, the care that we got here, I got here is phenomenal.
Thanks.
So with this agreement, we're able to bring further locally those kinds of skills, knowledge, and experiences right here locally with our people and with GMH. So we'll segue into Jolene and.
Can I just say something real quick?
Yes, ma'am.
Someone else in the ICU is gonna be covered, and yes, with like the two Keck hospital was awesome. And I say that though, that the hotel, I guess, just next door to, so it was very convenient and everything. But my ICU nurse came up, and I said, oh, my nurse said, Guam is Dr. Uggan. And she goes, Dr. Uggan, I think she was an intern.
Yeah.
Yeah,
She was.
so I was like, oh, okay, that's good. That's all, thank you.
Okay, so I will say that I was not the interim CEO, when I actually was preparing to go to Keck. I was assigned the point of contact as the head of special services for outpatient. And just recently, after the signing of the MOU, I had worked virtually with the international team and Dr. Kiros, preparing for this recent visit that I just had. And I have to say that it's been an absolute privilege visiting USC Keck, because it is where I trained in internal medicine and did my fellowship in pulmonary and critical care. So the partnership is both professional and very personal for me. Next slide. Sorry. Okay, so why Keck? And I think that the governor has made that pretty clear, and so has the lieutenant governor, that it's a nationally recognized institution. It's top 16 according to CMS in 2024. It's ranked top 50 in 8 specialties and top 10 in California. Next slide. Okay, sorry. So it also has proven telemedicine leadership. So they've had the telestroke program since the end of my fellowship in 2015, and that's been going pretty strong. They also do tele-GI, radiology, and they also do second opinions. Next slide. So access to care faces a lot of major challenges, including limited hospital space, specialty care and transportation barriers. Specialty care often requires very costly off-island travel, long waits causing financial and emotional strain on both the patients and their families. So innovative solutions are urgently needed to improve access for our vulnerable population. Next slide. Our vision is to remove these geographic barriers to care. We want to keep families united during their treatment and make Guam a leader in rural healthcare. Success will be measured by reduced medical travel, increased local healthcare jobs, better clinical outcomes, community pride, and the regional leadership. Next slide. So our MOU with USC Keck Medicine was signed in April of 2025, established a partnership built on telemedicine, training, exchanges, and legal protections. It sets a governance framework and marks Guam's first formal collaboration of its kind with a major mainland medical center, enhancing healthcare in the Pacific region. I'm going to stay right here just so that you can look at the different parts of this MOU, because a lot of people think that it's just a transfer of service that exists with other hospitals. But what's unique about this, it actually includes training and administrative collaboration, which is not included in other MOUs with our hospital. Keck is willing to partner on different levels, not just to provide a telemedicine or transport for a higher level of care services for our patients. Next slide. So this analysis highlights key challenges such as limited specialty care, as I mentioned, infrastructure issues, and workforce needs. Our opportunities include innovative payment models, strong community trust, proven partnerships, government investment, and a strategic location for regional healthcare leadership. Next slide. our strategy includes launching a telemedicine platform, developing specialty care programs, and strengthening our operations. We aim for seamless patient transitions and sustainable care through a 340B cost savings or group purchasing, all to reduce barriers and build local healthcare capacity. I'm gonna stop right here just to give you some ideas of conversations that have happened. So we met with Marty Sargent, who's the CEO of Keck, the head of the nursing managers. We met with all the specialty physicians that were available, and I think I met with maybe 8 or 9 of them, all heads of their departments. And things that we discussed were challenges that they have seen our patients experience going over there. And the initial program that I'd like to launch, first, because it's something that's very close within our reach, is really providing a pathway, a process for the Guam patients that are being referred to Keck for higher level or specialty care that's not provided on this island. Guam patients experience delay when they get there because sometimes their medical morbidities are not optimized. So if your diabetes is out of control and you're there for some kind of surgery, they're not going to do it. Our patients have to sit, they have to get optimized, then they can proceed with surgery. And that's a huge cost burden for them because now they're there, they're ready to go, but they can't actually go. So what we'd like to build is a pre-consultation at Guam Memorial Hospital where patients are referred to Keck through our hospital. Their records are evaluated with the international team of Keck, and then a pre-consultation via telemedicine with the physician who's going to be caring for them there. So that questions are answered from the patients. The expectation is at the upfront. And I'll tell you, there are patients on this island that have gone out for surgery and sent back because they are not good candidates. They spend a lot of money to get out there just to be sent back home. They go out there not realizing that cancer therapy is lengthy. They're not warned that they have to actually be out there for a certain amount of time. Our patients come home never to receive chemotherapy, never to receive chemotherapy, never to see those specialty oncologists that are not on this island. So a second program which will come that we like to try and build out is bringing Keck inside GMH. Have Keck run an oncology program within the hospital that GMH supports. Looking into, federal designations so that we can qualify for the 340B cost sharing or profit sharing. So that these cancer drugs could be availed of a lot cheaper, and having Guam patients stay home and actually receiving these therapies unless they have to go off island for higher specialty care or transplant. There's a lot of opportunity. They have a lot of resources, and these are just a few of them that were discussed. Before anything moves further, we have to do a statement of work. GMH is working on its processes so that we can support it. Dr. Rick Eusebio is the Chief Medical Officer or Associate Administrator of Medical Services. So we're working closely together. And before we proceed, we'll have to, again, meet with Keck so that we can decide which project we're going to start on first. The MOU is a 3-year agreement, and this MOU is actually created by Keck and can be continued, renewed as needed. Okay, next slide. So success is measured across clinical, operational, and financial areas. Targets include reducing patient stays, improving care access, boosting satisfaction, increasing efficiency, maintaining high IT uptime, and ensuring financial sustainability through optimized revenue and cost savings. And this is actually my mentors from USC Keck in the Pulmonary and Critical Care Division, one of which is the head of lung transplant. Oh, you can't see it. Last slide, sorry. They're still there, and they're ready to receive and ready to support the Guam Memorial Hospital and its community. Susan Smasi.
If I can just add that one of the most difficult things in life is dealing with the unknown. And we take care of patients here when a patient receives a diagnosis. And the physician lets them know what the plans are. It's always difficult to explain to the patient what our limitations are, so that when you give a patient the diagnosis and you tell them what the plans are, and part of those plans are that they need specialty care, it's very difficult to have that stability of knowing what the diagnosis is, and then the step off of where to go. This provides an avenue for patients to know exactly where to go, so that having a system whereby you utilize telemedicine and you see who your doctor is, you see where you're going to go, you define the goals and the plans and how it's going to be done here before you leave. That provides a lot of takes away a lot of the anxiety that patients have, and also as physicians, because we have to provide the referral to that patient, to that physician, and the institution, and knowing that here's the place where we're going to be able to refer the patient to, where we have a system that has been worked through, and that the physician and the patient knows that the patient will be taken care of there, and then after that come back, and the physician that's going to receive that patient, and also the patient knows everything is basically stable. Everything is basically known, so that the patient does not leave here not knowing where they're going to go, not knowing who their physician is, and will be attached to whoever it is that the patient has seen here and worked up here before going over there, having their procedure done, or taking care of whatever the specific diagnosis is, and then come back and then continue their care here, so that everything is all looped together without any unknown, and the stability for the patient, despite that disastrous diagnosis, knows that they're being taken care of. That's the value of this thing, and that's why it's so very important for us to be able to have something like this, because this is something that we've been trying to work on for many years but haven't been able to do it. So this is a gold mine for us. It's a gold mine for patients and a gold mine for physicians as well.
Thank you. And to ask Dr. Eusebio, the return is, again, with the international team and the Guam Memorial Hospital, to make sure that patients are not lost to follow-up when they come home, that their appointments are already set up and they can have continuity of care. I will tell you that other things that were discussed is that the governor has been working on the housing for the community, for the patients of Guam, and trying to see whether or not the government can purchase or rent the Keck USC dormitories, which really look like hotel suites that are attached. They're on the campus, so that there is a subsidy for the patients when they go. That's more affordable than staying in a hotel, and you are on site.
At this time, we want to go ahead and highlight Dr. Carroll and CP and the partners from the international services would like to say anything.
Well, good morning to everybody. On the far away from the camera, I cannot recognize faces this far. But in any case, it's great to have this presentation, especially at a time where the need for further medical care or prolongation of the bases that have been set up on island over the past several decades. I think that 30 years ago, when I first came on island, it was more or less everybody goes off island, cough, went off island for a procedure. Over the ensuing decades, the physicians on island, leaders on island have been working to more and more care that more for a system that will care for patients on island, which is paramount. And little by little, it has brought us to the point now where we can do a lot of medical care on island, primary care, secondary care. But like any other part in the world, tertiary care, quaternary care has to be done at very specialized institutions. I'm a cardiologist by trade, and for example, our recommendations nowadays, suggest that certain conditions in cardiovascular disease are to be taken care of in very specialized centers. And so we have moved to this point where now a relationship with one of the centers that has quaternary, tertiary care is able to participate with us on island. So this project, has been in the make for the past several years, but I think we're to the point now where we can bring it to fruition. I think that steps will have to be very slow in the beginning, especially starting out with medical care, simple, straightforward management of significant cases, high risk cases, and eventually expanding to other fields. And personally, I think that if this relationship progresses, it will not only be extended to GMH, but also hopefully to the university and other institutions that the island may benefit from, especially with having the expertise of well-known institutions such as USC, Keck Medical Center. So I think that long-term, this will be an extremely valuable relationship for the island, and of course for Keck itself, because the island will help Keck as well in different ways, including the reciprocal, shall we say, training of some of the physicians as well. So I think we're the cusp of achieving something that has been brewing for decades, and I think that we should be able to bring it across the goal line.
Thank you, Dr. Kira. So we had actually had this thought of increasing access to care and piloting the Medicaid and GovGuam patients. Of course, open to everybody, but definitely wanting to make sure that we can increase access to care for our GovGuam workers and our Medicaid population. Medicaid and MIP.
It is by all means, and of course, that we all know the insurance companies in Guam do have contracts with Keck, and they have made it very easy for these patients to receive care there as well. So yes, we can start with Medicaid population, with controllable population as the project evolves, but keeping in mind that yes, other patients will have access as well.
Absolutely.
All right, thank you. Thank you everybody for all of your insight. At this time, we're gonna go ahead and look to our media, or if anyone has any questions, we kindly ask that you state your name and the organization you're with.
Jolene Tovis from the Guam Daily Post. Good afternoon. I just have a couple of questions. When will Guam patients begin to see shorter wait times for specialist care because of this partnership? Because oftentimes, as you mentioned, they have to travel off island, and this makes telemedicine a easy we start seeing, a reduction in wait times, patients actually getting out to see the doctors that they need through this partnership? And do you guys have like a number of patients you want to push through this program and to help through this program?
So as far as the wait time, so the way this works with the MOU is we need to create a statement of work. And with a buy-in with everybody, we can now create that statement of work. So that needs to be developed. And the first program that we want to create is having that seamless transition. The international team of Keck works very quickly, that it's really the insurance companies that delay for them to go, or it's a financial burden. So making that connection shouldn't be too difficult, but actually making sure that it's gonna be a covered benefit, and whether or not the patients can pay for the accommodations are what I think will be the limiting factor.
So Jolene, there is already a process that's happening, right? Patients from here are already being referred to Keck, and you heard the testimonies. And I think the program or the process of getting everything here done before they actually go can start right away. Because the doctors can say, okay, let's do your EKG here, let's do your colonoscopy here, let's do your echocardiogram here, let's even do your angio here, so that everything is ready, so that when they go back, so that is what's going to make the time shorter and the delay shorter. But we don't have to wait for the SOW to happen, that's already happening. And when I went to Keck, I think last year, I met with key specialty doctors, OBGYN, for example. And they said that, Governor, you don't have to spend a lot of money at Keck doing these basic kinds of procedures and tests that we can do in Guam, right? So they're very in tune to also cost savings and cost benefits, right? And so again, I would say that can happen right away, and I'm pretty sure it's already happening.
What GMH is trying to, go ahead.
Yeah, if I may add to that, I mean, the process is in place already, as the governor was saying. I mean, we've been doing this for the past several years, especially with our cardiovascular patients, with our cardiac patients. For example, some of those patients come in, do all the cardiovascular workup in Guam, including the angiogram. Once you have those results, those records that the patient is again willing to travel off island, with the insurance blessing, I send the records to California, which are reviewed. And then once we make the decision that yes, the patient is a candidate, then the process begins to take place, and the patient travels whenever the patient is ready to go. Under certain circumstances, the patient has to travel today, for example, because of a high risk, because of a critical condition. By the same token, over the past couple of months when I was there, I had a couple of patients that reviewed the cases, and they were not candidates for interventions, in which case basically meant that the patient would have to be treated in one. Didn't have to travel to have nothing done, shall we say.
And
So the process is in place already.
There is a process, what we're trying to do is expand that process.
Right.
Facilitate it,
Okay.
basically to make it easier. The process is happening, it's just a matter of shortening the timeline so that we can facilitate it and make it smooth.
Make it consistent and much more organized.
Do you already have, does GMH have an idea how many off-island referrals have been reduced, since this partnership? Like how many patients, like, as you mentioned, there's a lot of procedures that they can then get done here, right? And they don't have to go off-island, so, what's the reduction in off-island referrals?
Well, I think that's what we need to measure. So we should see what the insurance companies are actually sending off and then seeing whether or not there is a true reduction. There are specialties that, they don't have to be for, if we're able to create other programs beyond facilitating the off-island, referral process.
I understand there's an educational component to this partnership. Is GMH and Keck planning on developing this partnership further with UOG to create a pipeline, to train, incoming nurses, or
I think
whatnot?
that that's a program that we would look forward to in the future, because right now the MOU is with GMH and Keck. But as Dr. Quiroz had stated, this is something that if we can develop this relationship, it can expand into the community.
And when you were saying that, I was getting excited, right? Because there's no reason why UOG cannot partner with USC. And for example, hey, let's do a medical program. And maybe in the beginning, UOG can do the basic preliminary pre-med stuff, right? And then hook right into USC for our students to go to USC for medical or other healthcare specialties that we don't have here in training. Physical therapy is one.
Is there anybody else?
Just one more question. I know this is a partnership. Does that mean, or are any of the Keck doctors on contract with GMH through this partnership to be paid by GMH, or is this just a completely, okay, so nothing for the telemedicine services, that's,
None at this time.
thank you, that's all.
Thank you. Is there any other questions in the digital space that maybe we like this? All right. If that's all, on behalf of the Guam Memorial Hospital Authority, we just wanted to express our sincerest gratitude to the governor, as well as the lieutenant governor, as well as Dr. Quiroz for joining in from so far away, and as well as our interim CEO, Dr. Delaney Nugget. This partnership represents an important step forward thinking for Guam's healthcare system. And we are excited for the opportunities it will bring to our patients, our facility, our staff, as well as our community. So thank you all for being here. If there's any other last comments?
I do want to make a last comment. And my last comment is this. Out in the community, people are always saying, why are we just focusing on hospital facility? And you'll hear critics say, why are we going to build a new hospital and put in the same management, and why aren't we improving the operations and expanding administration and bringing in all the needed tools and resources to beef up and improve our billing, our collections, our IT, our electronic health records, all of that, right? Well, this is it. This is what GMH has gone through to get that part, a very, very crucial part of healthcare delivery, right? So now, Jolene, there's gonna be a new hospital, and then now we've started improving the management on the operations so that when we gel these two, and hopefully we're gonna be very aggressive with the operations part, the clinical part, the operations part, and of course the hospital facility.
Thank you. So thank you again for all being here. We appreciate our media partners for helping us share our story. Have a wonderful day.
Thank you.
Thank you.